Last night's assignment, we were going over Cptsd and Ptsd. There's a difference. Complex Ptsd and PTSD. If you don't know what PTSD stands for, it means post-traumatic stress disorder. You can get it from a variety of things. You can get it from a singular event. You can get it from a multitude of events over the course of your lifetime, which in this case, for this discussion post, he does have Cptsd. The primary symptoms of PTSD are present in Cptsd, along with further disruptions that affect regulation, interpersonal dysfunction, and negative self-concept. Early and ongoing trauma, when you don't have any treatment intervention, it can significantly increase the amount of symptoms that somebody's having, But when people hear that, sometimes they think, oh, isolation, or they're not talking to anyone, they just turn awkward. Like, no. Sometimes people with CPTSD can turn into volatile behaviors. Their limbic system can be jacked up, because listen to this. Early negative experiences increase susceptibility to PTSD by interfering with stress response systems such as the limbic system and the hypothalamic pituitary adrenal HPA axis, which control emotional and behavioral reactions. Chronic hypervigilance, impatience, emotional numbness, and interpersonal connection difficulties are all influenced by these neurobiological alterations. Not only this though, but we started learning a little bit about personality disorders last night, and in specific, we talked about paranoid personality disorder and avoidant personality disorder. Now, I know about paranoid disorders and avoidant personality disorders, but not to the extent that we talked about it last night. They describe them as trauma adaptations. Now, this is something that does make sense, but I guess when you're just looking at the term itself, it's kind of like maybe they were born with it. But from what this is saying is that it's kind of brought on into your family or how you were raised or who you were around. It's not always family, you know, but it can create feelings of inadequacy, hypersensitivity to unfavorable appraisal, and social disengagement are characteristics of the avoidant personality disorder. Talking about these is so surreal. I had to order the DSM last night and go over what this guy has, what they think he might have. I guess it just brought a bigger picture to the light of what I'm doing. I'm like, holy cow, like I'm actually going to the DSM now and diagnosing and looking at those diagnostic criteria and looking at what else possibly he could have, or that I ruled out that he didn't have, and why I said he didn't have it. It's a lot. It's a lot of paperwork, and it's only going to get more from here on out, but I wanted to show you guys a snippet of it right now. Don't worry, we're going to be talking about this more. I'm filming a behind the scenes voiceover right now throughout my week for Florida, so stay tuned.